So is it really sciatica nerve pain, or is it something else? My name is Dr. Chad Kuntz. I'm a sports physical therapist, and it's so important that if you're suffering with what feels like sciatica nerve pain, that you get the proper diagnosis. And we're going to take some time to kind of go through the top 3 other diagnoses that it could be. Certainly we're not limited to it, but I did want to kind of give you an idea of what else might be causing your pain. And we're going to kind of break them down and then go over what sciatica nerve feels like too at the end. So the first one that we're going to talk about is hamstring myofascial syndrome. Hamstring myofascial, like what? Syndrome is painful to touch. It's only painful to touch. There's no other radicular symptoms, which means the pain doesn't travel. It doesn't feel as nervy, and there's really no difference morning or night. So just to use this picture here, I typically find with hamstring myofascial pain syndrome, it usually is in the middle belly. I'm going to give you a lighter color here. It usually is in the middle belly. However, the pain isn't referring all the way up or all the way down. People who have myofascial hamstring pain syndrome, it's usually localized to one spot. Now, pain can be very severe, which makes people think that they have sciatica. Talking to friends, talking to coworkers, talking to family, and, oh yeah, I had something like that, I think it was sciatica. So people fall into that pot quite a bit. So that's why I'm trying to help provide some objective evidence and subjective evidence as to what you might be feeling. Okay, so keep in mind hamstring myofascial pain syndrome. Also too, lumbar radiculopathy kind of neighbors or at times almost mirrors some angles of sciatica. The thing is, if it's acute, it's usually worse in the mornings compared to evenings. Pain can refer down the leg. Okay, so if you have lumbar radiculopathy, the key thing here is that it would actually start most likely in the low back, or if you have pain across your low back, it will refer down, and this would be in the L5 dermatome. All right, the L5 or S1 dermatome are areas of competing interest with sciatica, because sciatica is, this big nerve right here that runs down. So the L5 and S1 branches that come from your low back, they can make things questionable. If you're having truly radiculopathy coming from the back or the sciatic nerve. But the easy thing is with sciatica is that it starts here and it usually runs down. In my experience, people see it in the back of the knee and it can go all the way down to the midfoot. Now the thing is too, guys, if you have pain that runs on the side of your leg or even the front of your thigh, it's not sciatica. Or heck, even for that matter, on the inside of your leg, it's not sciatica. Alright? Lumbar radiculopathy very well may be what you have. If it's in the front of the thigh or the side of the leg, that's what I mean by multiple pain patterns. And these people tend to not like sitting or potentially standing. They'll stand for a really long period of time and then go, back and my leg's starting to bother me, I gotta sit down. They may not like sitting down after a while either though. Hamstring tendinopathy is the third one I want to go over today that can kind of mask what may feel like sciatica nerve pain. Again, it's usually local to the tendon, okay? So here you can see kind of this white spot, which is the musculotendinous junction, okay? The musculotendinous junction. So again, that's right here where the white meets the muscle. And that's usually where people who have hamstring tendinopathy, that's where their pain is. Sciatica nerve, in my experience, would usually be a little bit lower in kind of the heart of the hamstring, or it'll be just above, I use a different color to demonstrate it here, just above where your hamstring tendinopathy problem is, right where the musculotendinous junction is. So believe it or not, it actually matters based upon where the location is. To you, it might just feel like somewhere along the backside, but to me, it's very important to figure out exactly where your pain's starting and happening. So furthermore, along this, hamstring tendinopathy is usually associated with a lot of hamstring work. You may not think of it, but maybe you're bending over and picking up things all the time, or you started a new job, or maybe, heck, you just started working out a lot more, but you might have a lot of weakness still in that hamstring, and it's causing some discomfort, because overused hamstrings can also cause it. So it really depends on what your history has been showing us as to why you're generating hamstring tendinopathy. True sciatic nerve pain They don't like sitting just because of, well, look, this big nerve that runs right underneath your ischial tuberosity, or that bony prominence where you're sitting. The nerve's basically right there. And yes, it is kind of true for people who have less cushion back there. They're kind of sitting on it more prominently, and that can irritate the sciatica nerve. I've seen people with having more sharp knife-like pain when it's bad, opposed to like just a dull ache, and it tends to refer down the back of the leg because that's exactly where it's at. Okay, in my experience, people usually feel it from about here to here. Now, the sciatica nerve does run all the way down, all the way into the ankle and foot, but I usually see people that complain of sciatica down to about the knee, and typically people lack mobility. They're very tight. So let me know if that helped, guys. I just want you to know how important it is that you find the right diagnosis that's right for you, or that is right for you. Sciatica nerve pain can have competing different diagnoses, and people tend to get overdiagnosed with sciatica. So I don't want you to spend your time, your money, your energy elsewhere for weeks, months, or heck, years trying to figure out the actual true diagnosis. So send us a message if you need more answers. You can shoot it over on our Facebook page, Instagram, you can text us. There's so many ways you get in contact with us, which is great nowadays. So I hope that helped explain a little bit more about what sciatica nerve pain is, and if you have it, and let us know if we can help. Take care.